The old idea is that you had to compartmentalize your life and segment science over here with analysis and reason and intellectuality, and then, you go over here and then you be spiritual, whatever that means to people. I think that's a nutty choice. It doesn't make any sense. Science has gone beyond this notion that we have to segment our life. I'll just give you one example. People who follow some sort of spiritual path in their life, it doesn't seem to matter which one, I might add, but if they follow one and stick with it, they live on average 7 to 14 years longer than people who do not. This is huge. This simply was not known a couple of decades ago. This is really not mysterious. There are a lot of reasons why people who follow a spiritual path might live longer. A lot of them who do simply have better health habits. They may smoke less or drink less or follow a vegetarian diet and so on. So there are a lot of reasons for this science and spirituality connection, particularly where medicine is concerned. Mind and body are not the same. I mean, we don't want to homogenize them. But the point is that we can't, from a practical point of view, separate mind and body. I'll give you a simple example. There's something in medicine which was a hot topic of research about 10 years ago. It's called the Black Monday syndrome. This refers to the finding that more American men die of a heart attack on Monday morning around 9 than at any other time. It has to do maybe with going back to work Monday morning at 9 a.m. Yeah. Therefore, job satisfaction has been shown to be a better predictor of first heart attack in men in the U.S. than blood pressure, cholesterol, and smoking. But if we say mind doesn't matter, it's just all body, then you have to toss out things like that. And stress is also a major factor in heart disease. And what is stress except some sort of cognitive experience? It's something that we relate to the mind. It's experienced through consciousness and the mind. So for any number of reasons, the idea of separating mind and body just won't work anymore. There's research now showing that people who are altruistic and help others have a more active immune response than people who are just self-oriented. We're networked together in this business, and I think that when we restrict our notions of health just to the individual, we get into trouble there too. We have to expand who we are to go beyond our sense of self, to envelop our relationship with other people. There's something called the helper's high in medicine. It's that sense of almost euphoria that some people get when they really do something for somebody else. And people who are involved in altruistic, charitable activities with respect to others live longer, in addition to having a healthier immune system. So you look at these sorts of involvements with the world, and it seems to be good for us, the more we interdigitated and related to other people. Over the past several years, there has been compelling evidence from many varieties of experiments showing that we can know the future to some degree. And these experiments now have been replicated all over the world. There are about a couple of dozen of them. They virtually all point in the same direction, showing that we have some sense of the future. This, I think, is hugely underestimated in terms of its importance for our health. I'll just give you an example. Think back to 9/11. The statistics show that those planes were on average 80% empty. The range was something like 74 to 84. It would appear that people have some sense of something impending that's not healthy for them, and they change their travel plans. About 40 successive train crashes were investigated, and invariably, on the day of the crash, there were fewer riders, statistically speaking, than on the 4 weeks prior to that. So if you put this to the test and see if people really can, in the laboratory, anticipate the future, the answer is a clear and stunning yes, they can. These are called presentiment experiments. They've been done now by Dr. Dean Radin in California and by many other researchers around the world, they show clearly that we can anticipate the future. Now, I think that this is hugely underestimated in terms of it's important for our health. I look at premonitions as a kind of preventive medicine. People regularly have premonitions about breast lumps, about something going on in their body that needs to be checked out, and when they do, they find, sure enough, that they were right on target. We need to take these things seriously. And again, this invites us to get past this idea that our consciousness is locked into the present moment and to our own brain and body. This whole idea of the self needs to be expanded. I mean, we're bigger than the individual body and brain, and we're not even limited to the present. We can know something ahead of time, and it's to our advantage to take that seriously.